My name is Imee Cambronero. I am a second-year student working towards my master's in public health, focusing on maternal and child health and global health. I'm interested in public health because I'm passionate about improving the health and quality and well-being of populations, not only here at the community level, but also at the global level. I wanted to go to an institution, number one, that had good faculty. The University of Minnesota, I was very impressed with the options that it gave its students for classes. I wanted to go to a research institution that I felt I could walk away with skills that are applicable to what I'm interested in doing. And the fact that the University of Minnesota, as a public institution, can compete with the big endowments, I think speaks volumes to the quality of education. I currently sit on the Finance and Operations Subcommittee for the Board of Regents. As a student representative, when you're looking at policies, whether it be health policies or administrative policies, I think it's important for people to have a voice. And so my role as a student representative to the Board of Regents is to represent the voices of all of the 17,000 graduate professional students at the University of Minnesota. Throughout my life, I guess you could say that I've always been active in student government or activity planning. And I think that's one of the things that also drives me to public health, is that community engagement. I love to dance. I started dancing when I was very young. It was kind of an activity that my parents thought it would be good for me to kind of let off a little bit of steam. But as I grew and developed more techniques and became more confident, I also started to teach dance.
Plie and up.
And so I teach ballet, tap, jazz, and hip hop. When I teach a class, I want to make sure that there's adequate time to do some activities across the floor to gauge where the technical level is among the students. Try to teach an 8-count and then review and then kind of build upon pieces of a routine so that everyone can kind of have this final piece together when you're all done. The thing about dancing is that I think it brings people together. The thing that I like best about teaching dance is giving people something to take with them.
Keep breathing, you guys.
So it's that kind of sense of accomplishment, it's that sense of lifting someone's spirit. And I think it leaves people with just a really good feeling.
High five!
For my master's project, I am doing a qualitative documentary film. The goal of the documentary is to get a qualitative piece of what is family planning in India, but also do an education piece to those who might not know about family planning in other countries. The theme of the documentary is what are the incentives and the barriers which influence whether or not a woman or a couple will use family planning methods. I went to 2 different regions in India, one in the north and one in the south. I talked with women regarding family planning. What do you know about family planning? Where do you get your information? These are the questions I would ask the mothers. And from that, I'm creating a documentary comparing the North and the South. What I'm hoping to do is really tell a story about these women and what it's like for them in their villages. I think the things I'll take away from my time here at the university and the MCH program are the relationships that I've built with the faculty, with the staff, and also with the students, because I think the time that we've spent here, we've grown a lot as individuals, and we've become a part of each other's lives that I think will stay with us forever.